Hi guys, I'm Travis Weisbrod. I'm originally from the Bay Area, California. I'm also an alumni here of St. Christopher's from 2011, and I'm currently our wellness director. I got my master's degree in kinesiology from Louisiana State University right here in Baton Rouge, and I'm also a certified exercise physiologist, strength and conditioning specialist, and ACE behavior change specialist. So a lot of my passion in being the wellness director here comes from my own experience with exercise and with substance abuse recovery. Before I came to treatment, I had a lot of my own issues with exercise, with body image, and with supplement abuse. And then after coming to treatment, I was able to work on those issues while here, and also to be able to exercise in a healthy way that's healthy for my body, but also not in an obsessive or compulsive way that's harmful to my social life, to my employment status, to relationships. And being able to balance those two things, I've found has been one of the best things in my life. And wanting to share that experience with the guys here has been really important for me. So the wellness program here at St. Christopher's is a lot more than just getting in shape or meeting fitness goals. That's certainly an awesome side effect of exercise, but it's not the sole purpose of why we do it. The real reason why we include exercise into our treatment model is because of its robust effect on depression symptoms and mental health. It can also help with anxiety, with normalizing sleep patterns, with normalizing appetite and feeding patterns, and it's been shown to have a pretty robust effect on things like self-esteem, self-confidence, self-efficacy. So it's really an important piece of our treatment here. And over the past 2 years, we've also managed to track some of the client data as they come through here. So what we've done is kind of informal research. We found that those patients that have participated at the highest levels in the wellness program, those patients tend to have much better treatment outcomes than the patients that participate at really low levels or no levels at all. And so, what I'm really looking forward to in the next few years here is to continue that research and look at how exercise can positively impact treatment outcomes. Hey guys, I'm here with Connor. He's a recovery advocate and a prestigious alumni of our program as well. I chose Connor today to talk to because he was so highly participatory in the wellness program. And when I first sat down with him, when he first came in, it sounded like exercise and physical fitness was not a thing that is on his radar. He hadn't been doing any kind of sports or hobbies or anything like that. And he had mentioned that that's something he would be interested in doing. And here he is. He just picked up a year sober. So I'm just going to ask him a few questions about his experience with the Wellness Center. So the first one, we'll just give you an easy one here. What did you like about the Wellness Center?
Well, I like that y'all had one. But yeah, you came in and met with me at primary. I was stoked about it. We laid out goals. I knew that you knew what you were talking about, and you were like pumped to help me along the way. But yeah, one of the first things I lost in addiction was my health and fitness and hobbies. And that was one of the main things I wanted to get back. I know that helps me, and I knew it would help me. So you helped me achieve the goals in there. It helps me to get through my day. It relieves my anxiety and just helps me to be a better person. And it's something I look forward to every day when I was in treatment.
So it sounds, so in treatment, but it sounds also like this is something that potentially you still do. Is that right? Have you been able to continue to do the things you did in treatment as far as fitness related afterwards?
Definitely. I met my treatment goals, which was huge. I wanted to get in the 1,000-pound club. I told you that the first day I met you, and that was my main goal. I got it. It was awesome, but I just keep pushing. I'm still in there about 3 days a week. I show up whenever I can. I go to yoga, which is a huge help for my body and just anxiety in general. But still go to sports. Mm-hmm. That's still the favorite day of the week for me is Fridays. We get to play sports with the boys, and it's just I thought that sports were over for me, which I was super bummed out about. But that's like one of my favorite things to do here. I'll keep doing it as long as I can.
Awesome. So one of the more interesting things that has come up in the past year or two, being the wellness director here at St. Christopher's, is just the prevalence of co-occurring disorders that can happen with guys that come in for substance abuse and mental health treatment. One of the things that we've unearthed here is the prevalence of things like body dysmorphia, things like supplement and anabolic use, outside of substance abuse, things like muscle dysmorphia, just even if it's subclinical at a level where it still affects them negatively, but they aren't going to be diagnosed with muscle dysmorphia, but it still affects their ability to live a happy life. So one of the more important things that I do here is look for signs and symptoms of those kind of disorders and make sure that the clinical team here is aware of those. And a lot of times guys coming into treatment, those signs and symptoms don't come to present themselves until they're a few weeks, few months sober, they're working out, they're feeling good, and then you start to see a little bit of a cross addiction start to form, and the next thing you know, some of that can become an obsessive compulsive disorder where you're overly focused on your body, you're thinking, okay, well, this isn't enough, what can make this better, how can I get bigger, well, if I take something like steroids or some SARMs or some other anabolics, there's the potential that this is gonna help me meet my goals, and I feel good and I'm healthy, so this is okay, right? And we see that, and we've seen that a lot, and so it's really important to be able to identify it early on and make sure that it's addressed. All right, so we're here. This is the St. Christopher's Wellness Center. Behind me is a house where we have our instructional demo kitchen, where we'll teach guys how to cook basic meals, teach them some food prep skills, and some just basic nutritional facts. The first area we're going to be going into is our cardio studio. So we'll just go ahead and take a look in here. So the cardio studio is where we do aerobic training for guys that have goals that are more based around aerobic fitness. This is where we do a lot of that, and we also will do warm-ups for basically every client in here as well. The next area is our resistance training area, and this is where we have a bulk of the trainings. A lot of our circuit training takes place in here. We'll also do a lot of fitness instruction piece in here. When I first meet with our clients, we'll do a one-on-one in here where we'll set goals, we'll make a plan and a plan of action, and then we will reassess every few weeks on how we're doing on that plan as well. All right, so we are here now in the yoga studio. It's also our free weight training area and a space for us to do MMA and boxing training as well for the guys that enjoy that. And why don't you spend a lot of time in this room, why don't you tell me a little bit about what your favorite things were to do in here?
Yeah, I probably spend most of my time in here between the free weights and the yoga. I came here after an injury, and yoga was necessary for me. I had hip pain, my back was hurting, and 2 days a week I could come in here and just stretch it out, relax and chill, and just it benefits me with sports and with my life and everything. But yeah, I took full advantage of the yoga, and I'm super glad that I did.
And the great thing about this space is that it is a big enough room to be able to do yoga for really any number of guys. So we've had 10, 15 guys in here, and there's still space to be able to move comfortably, and you don't feel all crammed in here. So it's really one of the best buildings of the buildings that we have over here at the Wellness Center. It's one of the most used for sure. So we'll go ahead and I'll show you the outdoor space, because we also use this piece quite a bit when weather permits. In Louisiana it can be rainy at times, but this outdoor space is a great change of pace for guys to be able to do some outdoor plyometric work, and also if they're trying to train for certain sports, this is a really good space to be able to do that sport-specific training. So that's the St. Christopher's Wellness Center. I hope you guys enjoyed the tour as much as I enjoyed giving it, and I hope you guys learned a little bit about why we do this and why it's so unique and important to be able to address this physical piece here for people in mental health recovery and substance abuse recovery. We've been doing this here for 25 years, and I really hope to continue to do this for the next 25.